Bismillah rahman rahim. Fracture of the nasal bone. If you feel or see your nose, now there are two parts of the nose. One is the lower mobile or more flexible part, while the other part is upper part, which is hard and bony. Now this bridge of the nose is formed of two nasal bone, right and left nasal bone, which is further strengthened by two processes called as the frontal process of the maxillary bone. Now, as nose is the most prominent part of the face, so it is more prone to injuries in road traffic accidents, sports, or person-to-person assault, or even in fall from any height. So it's more prone to injuries. Now, these are two very weak nasal bone, and as I mentioned, it is more prone to injuries. So the fracture of the nasal bone is one of the commonest fracture. When there is fracture of the nasal bone, there might be an obvious deformity of the nose as well. That is, nose will be deviated to one side or other side, or bridge of the nose might be depressed. When it is a bit severe injuries, the nasal septum, which separates the right and left nostril from each other, that may also be fractured or affected. So most of the time there is blood collection in the septum, and that we call as the septal hematoma. But if there is no collection and the bony or the cartilaginous part is fractured, then there is deviation of the nasal septum, which we call as DNS in our own technical terms. So when there is fracture of the nasal bone, as I mentioned, there might be any obvious deformity, or there might not be any obvious deformity, and the fracture might be confirmed by X-ray, which is necessary in case of medical legal cases. After the injury, in a few hours, there is swelling of the bridge of the nasal bone, and you can't assess the deformity. So that's why we as ENT surgeon wait for a couple of weeks so the edema or the swelling subsides and the deformity become obvious. If there is deformity of the nasal bone, it is deviated to one side or other side, or if there is blood collection in the septum. If there is collection in the blood septum, that is septal hematoma, and that needs urgent drainage. But if there is no hematoma and the only problem is the deformity of the nose, then you can tackle after 2 weeks, and the procedure is to realign the deformed bones into its normal anatomical position, and it needs manipulation under general anesthesia, or it can be done under local anesthesia as well. Thank you very much.